Joining us now is Ron Klain. He was chosen by President Obama to lead that Ebola response. He was chief of staff to Vice President Al Gore and Vice President Joe Biden. Mr. Klain, it's great to have you here. Thank you.
Thanks for having me, Rachel.
At some point, I'm going to get you here at the desk with me in New York, and we are going to have a long talk about how this is all supposed to go.
Yes.
But tonight, let me just ask you point blank, if you are worried about how the Trump administration is handling this crisis thus far.
Of course I am. I mean, I think anything that could be done wrong probably has been done wrong. That starts with the president himself continuing to make inaccurate statements about the consequences of the policies adopted, inaccurate statements about the pace of vaccine development, about the likely spread of the disease in the United States. And you couple that with the announcement today, the implementation today of a decision to silence our senior public health officials. People like Tony Fauci, who served 7 U.S. presidents, won the Presidential Medal of Freedom, is the world's leading expert on infectious diseases, ordered by the White House today to stop briefing the public. So you have a bunch of bad decisions by the president, an effort to silence the people who can give the public the straight information. That's a very bad combination.
In terms of those sort of dual problems that you were just describing there, obviously, in a real response, a real and responsible response to this kind of a crisis, you do want coordinated messaging. You do want a united front. You do want the United States government speaking clearly and with authority and saying true things. You want somebody like Tony Fauci briefing the public in terms of the public health threat here. With the president repeatedly saying things that are not true, does it make sense to have somebody trying to coordinate messaging? I mean, do you have to have somebody rebutting the president and saying, no, we're not going to have a shot for this real soon. No, there aren't only 15 cases. No, we're not going to 0 cases. I mean, I don't have too much sympathy with Vice President Mike Pence being in charge of this. But if I were him, I would have no idea how to coordinate U.S. government communications around this with the guy at the top saying the things that he's saying.
Well, you know, Rachel, I think at this stage in the game, anyone who believes what President Trump says kind of gets what they deserve. The challenge is there a place where people can get reliable information? And that is our public health officials, our nonpartisan public health officials, people like Dr. Fauci, people like Dr. Schuchat at CDC, who was in the briefing room last night as well. And so, you know, when I was running the Ebola response, we made a decision that I would be behind the scenes. I coordinated with a team our policy implementation, the effort to deploy people to West Africa, the effort to get our hospitals ready here at home. And we had people like Dr. Fauci, people like Dr. Tom Frieden, then the head of CDC, be the public spokespeople. The American people don't need to hear from Donald Trump or Mike Pence about the coronavirus. They need to hear from the experts who know the facts, who know what's happening. What Vice President Pence should be doing, or whoever else he's brought in to work on this, should be speeding up our response. Our response is too slow. We are not getting hospitals ready. We are not getting testing kits deployed. We are not doing the double time work we should be doing to be getting ready for the inevitable.